There's no question that this is the best residency program in the country. Each of you is going to make, during your career, such incredible benefits to society. Just imagine where you are now, just finishing medical school, compared to where you're going to be at the end of residency. You're going to be able to take care of any patient in this hospital, the sickest of the sick patients. It's a journey to get there, and it's a lot of work, but it's also very rewarding, it's very fulfilling, and it's the most formative years of your professional career.
General surgery residency, by definition, you are going to be put into situations where you're not necessarily the most comfortable. I learned how to lean into those situations and use those as really learning opportunities to make me a better doctor.
I am continuously impressed by the ability of the residents. They approach things from a more holistic view, and what we can do is enhance those things and to focus on those positives, because ultimately at the end of the day, we know that we're here for our patients, and those personal connections that we feel, even if we're only a part of that patient's life for an hour, are things that are going to stay with us forever.
There's no question that surgical residency is difficult, it's challenging, it's demanding. There's so much to learn in the 5 clinical years and 2+ research years during your training. It's our goal that at the end of that road that you are independent, a master researcher that's going to really make an impact in our field and move the field forward and change the standard of care for surgical diseases.
The social justice movement actually is about us and about our patients. A lot of our residents, particularly here at UCLA, they are woke. They get it. They get it in a way that I dreamt about 10 years ago, and now it's happening. They get it in a way that we were not even thinking about 20 years ago. They come looking for opportunities to serve the whole patient. They know as surgeons they're not anatomists. They're people who are treating other people. And during this time of opportunity for social justice is just extraordinary. I mean, you look and you see the leadership around a roadmap for anti-racism. You see the dean of the School of Medicine here starting a health equity theme. You see the CEO of the hospital hiring an equity, diversity, and inclusion officer. These are like incredible steps. And now we're integrating all these components. Some of them are grassroots and some of them are coming from the top down. It is just an incredible opportunity for growth. UCLA has stepped up in such a big way, and I think the residents have that opportunity to get involved every step of the way and set their career path.
The amazing thing about UCLA is regardless of what your interests are, what career you want in the future, there are opportunities here for you. Whether you are like me and you want to do global health, public health research, whether you want to learn to be an advocate for your patients, whether you want to be involved in biodesign or do bench research, there are faculty and residents here doing those sorts of things, and you will absolutely be accepted with opportunities to get involved, both during your clinical years and during your research time.
We're very lucky that our main hospital is on the campus of the #1 public university in the country, and the opportunity to do any type of research is just within walking distance. So our residents do all sorts of interesting things, and the department is very supportive of the paths that they choose, as long as they come out with a work product and a skill set that's going to make it so that they're going to be successful.
I tell the applicants when they go to look at programs to not only look at the resources and opportunities that are available at a program or at an institution, look at what you could accomplish with those resources and opportunities. It's those extra 2 years that's going to distinguish you as an academic surgeon. You're going to get the skills, you're going to get the tools that you need in order to do research, in order to make our field better, in order to discover things, in order to innovate.
I think when we look at our applicants and decide who would work best to train here, oftentimes I come to realize that our applicants and our residents have had other life experiences outside of medical school. You know, some of them have families, have had interesting other work experiences. They're the type of people that you want to go to dinner with.
Over 7 years, you really do build a relationship with a lot of these attendings, and they become your colleagues, your friends. Yeah, I'm definitely gonna miss the people.
I think it's important for us to not only experience work together, but to experience a little bit of life together. And so I guess what I can say to you about the program here is those, off-camera, unscripted conversations and dynamics between our residents are so genuinely strong. And also there's a great dynamic between the residents and the faculty to the point where, as you mature through the program, we see you as our colleagues rather than trainees.